Hi, marhaba. So today we have another session of our hot topics, which we do every Thursday. So check out every Thursday. And today we've gone to talk about a very special topic, breast augmentation. It's a very common topic, and a lot of plastic surgery happen there. And we have lovely Laila here with us, and she's going to ask me some questions about breast augmentation, and we try to answer that as much as possible.
Hello, doctor. How are you?
Hi.
I would like to ask you today about the different types of implants, the shapes, and the sizes.
Yes. Yeah, so when we talk about implants, they all come in a variety of sizes and they all come in a variety of shapes as well. The most commonly used breast implants are the round implants, which are used either above the muscle or below the muscle, and of course below the breast, to give a enhanced look of the breast augmentation. Now when we talk about the types of implant, then the types could be a textured implant, like we have one over here. This is like a textured one, so you can see the texturing out there, and these ones are called the smooth implants. So they can be used depending on what the patient type is and what kind of breast shape she has, and we can use those ones. Also, another thing is about the profile. Now if you see, this one is more like a flat profile. It is broader at the base and it is thin, whereas this is a shorter base and it is more projecting. So this is an increased profile, so this is a high profile, and this one is a medium profile, and you have similarly those types. Also, another type of shape is the teardrop shape or the anatomical shape. Now this kind of is a special implant. It is used in selective cases and in cases of breast reconstruction as well. So those are the different types of implants which are seen these days, and now in the 4th generation implants we have very good quality of implants as well.
And how is it with the breast implants, doctor? How permanent, how long can they stay in the body?
Right, so in the olden days we had not so very good quality of implants, and they were mainly of the silicone gel inside, and that silicone gel used to leak out, and then they used to form a very high rate of capsular contracture. So because of that, we need to change the implant every 5 years to maybe 10 years. Now we have the 4th generation, what are known as cohesive gel or the gummy bear implants. So even when they rupture, the gel does not leak out, and because of that reason they are very strong, and they are very sturdy implants, and these could be actually permanent. So once you do the implant, you might never need to change it, unless of course you have some problem like a displacement or an implant rupture or an infection or something like that, then you might need to change it, but if not, they can be permanent.
And mostly many patients, they would like to go for the breast lifting. It can be combined with the implants as well.
So that's a very good question, because a lot of ladies who are a little bit older in the age, we're talking about 35, 40 plus, when they want to get like a breast implant, or they have done breast implant when they were young and with time the breast have sagged down, then you need a breast lift as well. So when you need a breast lift and you need the volume, that can be done, and this can be done either by doing a periareolar, that means cutting just around the nipple and then lifting the areola up slightly and then putting the implant through that. Or we can do, if there is a major lift which is required and there is a lot of sagging, then we cut around the nipple and we drop down like a lollipop shape. Very rarely in a breast implant we might have to give a T, so that's like an inverted T, but that's like for more severe cases of breast reduction. But for a breast lift, a periareolar or a lollipop incision, you give that, you cut out the extra skin, you put the breast high, and then behind the breast or behind the muscle you put the implant to get the volume. So these can be combined, and it is combined very commonly. A breast lift with breast implant in one procedure saves time and money for the patient.
Doctor, how is it with the own body fat? It can be used for the breast augmentation. What do you recommend? What is better, to use an implant or the own body fat?
Fat is a very important asset, especially for us plastic surgeons. Fat is like liquid gold, literally speaking, and fat can be used in any part of the body for the same purpose, that is augmentation. It is most commonly used in the buttocks, but it can be used in the breast as well. Now fat, the advantage of it is your own body thing, so there is no foreign body or there is no problems which can happen from an implant, are all eliminated with fat. So you using your own body, your body accepts that better. However, fat can only give you a small volume. It cannot give you a very big volume. It can give you a small volume, and it will give you a more of a perky look. So if you need a bigger volume, then what I would recommend is to combine the best of both worlds. So you can use a small implant like this one, and then you can cover this implant at the same time with fat. So now you have half of fat and half of implant, and you've got the best look for both of them. And fat looks very natural, and there is of course a little bit of a absorption rate which can vary about 10 to 20%, but ultimately results are permanent, and a fat is a very good tool or a very good material for us to use in breast augmentation.